This is Dr. Caudill Miller. Today we're going to talk about Ubrelvy. We've been talking about migraine headaches and the drugs used for migraine headaches, and the G-pants came out and are really game changers. We really had basic pain medications, Midrin, and the wonderful triptans, and then the G-pants came out. And Ubrelvy, if I remember correctly, is the first one that we started using. And so we just love Ubrelvy. It's 50 to 100 milligram tablet, one at onset, repeat in 2 hours, no more than 200 milligrams in a 24-hour period of time. And it's one of these things, it is like the triptans. It's going to work great or not work at all. It's just a wonderful, medication. And side effects, we just don't see many side effects. Nausea, the main one, don't see that much. Some indigestion, stomach pain, a little bit of sleepiness. Sometimes the nose will stop up. Rare allergic reaction, which I've never seen. I've never seen a doctor that's seen it, but if you should develop any swelling around the face and eyes and throat, tongue, any rash or hives, catch it early because it could be severe. It was not present in any of the earlier marketing studies, and it's been reported even though none of us have seen it. Probably the negative about, this class of drugs in Ubrelvy is that it's metabolized by CYP3A4. So inhibitors, raise the drug level, inducers lower it. So, if you have an inhibitor, it can, make the drug more potent. And it's really hard to keep up with all these medications that are inducers or inhibitors. So it's, you're just going to have to, look it up. If you're given this medicine, look at all the medicines you're on. All the antifungals, which we hardly ever use, the macrolide antibiotics, which we don't use in our practice. We use some of the others like verapamil, which is a moderate, inhibitor, Cipro. I don't write antibiotics, but it's interesting, grapefruit juice, so don't drink grapefruit juice. And if you do, don't take a second dose for 24 hours. Inducers, many and most of the anticonvulsants are inducers, Dilantin, Tegretol, barbiturates. So the PI recommends not taking them. I think if you take them, you got to realize the drug's not as effective. That's the main thing. St. John's wort, which people used to use a lot, or Fampin we use for TB. So I just think that, if you have a medicine list and you're a provider and you give Ubrelvy, you just got to go over the medicine list. That's all you can do. It's going to change daily, and I don't think you have to, memorize it, but most of these weird drugs, you don't use, but some of the basic ones you do. So this is a great choice, and we have used it a couple of years. I think that's about how long it's been out. We just haven't had any side effects, and just love Ubrelvy, and give it a try. It's a great thing about having the triptans, the monoclonals, the G-pants, and then the ditans is that you've got so many different things to try now. One doesn't work, try another. So subscribe to my channel, like my channel, make any comments, and we're going to continue to talk about problems you see in a neurology practice as an outpatient. More later.